Hi, Laura. How are you?
I'm great. How are you doing?
Great. I think we're good on Facebook. I'm thrilled that you're here today to chat. Uh,
Yes, happy to help you out and hopefully answer some questions.
yeah, we actually had an earlier session today, and some people it was a financing your fertility journey session, and some people there had questions specifically about the Ontario program. So I hope that
hmm
they'll be tuning in today. So
Okay,
thank you, everybody.
perfect.
Thanks for joining us today. My name is Carolyn Dubé. I'm the executive director of Fertility Matters Canada, and we are in the middle of our Figuring Out Fertility Facebook series with fertility experts in Canada, talking to you and bringing you the information and resources that you need to help you navigate your fertility journey, especially during this COVID waiting period and as we celebrate CIAW 2020. I'm thrilled today to bring you Laura von Hagen, who is on the board of directors with Conceivable Dreams. Conceivable Dreams is the provincial patient advocacy group for Ontario, and they've been instrumental in helping with the Ontario Fertility Funding Program. So Laura's here to talk to you about that program for you to get a better understanding. We're thrilled that you're here because we partner closely with
hmm
Conceivable Dreams. We believe in their mission and their vision, and we're all in this together to ensure equal access to care across this country. So without further ado, Laura, I'll hand it over to you, and I'll put myself on mute.
Well, thank you, Carolyn. We're very excited to be here. And as she said, I'm here on behalf of Conceivable Dreams. And we are specifically here in Ontario. And what we do is we advocate for access to funded IVF programs, ensuring that everyone is able to build their families. And so what I'm going to be speaking about a little bit today is the Ontario Fertility Program. And Carolyn, if you have any questions at any point, feel free to jump in, or if anyone's in the comment section has any questions, and I'll try my best to answer you. And I do want to start off by saying for anyone whose their treatment has been delayed or canceled because of COVID, first off, we are so sorry about this, and really feel for you and want to advocate on behalf of our patients. And we have put out a survey asking people for their responses on this and how that's affected them and their funding. So you can definitely connect with us, and we'd be happy to get some responses from you. So as I said, today I'm speaking specifically about Ontario, because it's in Ontario we have access right now to some funded fertility treatments. And that one is the Ontario Fertility Program. And so it's a specialized program designed at increasing access to fertility treatments, and that includes fertility preservation, IUIs, and IVF. And so in order to access these programs, you do have to have a valid OHIP card. So this is specific to people in Ontario. And the program's actually been around since December of 2015. So we're coming up on our 5th anniversary, which is super exciting. And hopefully we'll be having a little bit of a celebration then in December. And as at this point, the really interesting thing is that we've actually had over 25,000 patients receive a funded IUI through the Ontario Fertility Program, and more than 16,000 patients receiving funded IVF through the program. And so that
That's
makes
amazing.
us, I know, right? Isn't it like when you think about how many people that is and how much that's helped so many citizens here in Ontario, it's a really nice to see that the program continues to grow. And we were a bit concerned at first with the change in the provincial leadership, and we're so happy and proud to see that as of right now, that funding has been continued, and we really want to advocate for it to continue for the next fiscal year, given all the changes. So how does it work? And so with the program, essentially, the funding follows the person who is trying to get pregnant. And it doesn't matter based on your sexual orientation or your family status, but you are able to get unlimited cycles of IUI, so intrauterine insemination, which is a form of artificial insemination. You're able to get 1 round of fertility preservation. So that could be due to cancer or some other medical condition where you need to preserve those eggs, and 1 round of IVF per lifetime. The exception is if you're acting as a donor or a surrogate, then you get 1 additional round. And so with the funded IUI, as I said, you do need to have a valid OHIP card, and that's going to cover your cycle monitoring, your blood tests, your ultrasounds, your appointment with your physician. What it's not going to cover is things like your medication, your sperm washing, if you need to purchase donor sperm, if you're doing any counseling, or some various optional tests. And so things like AMH, which is our measure of ovarian reserve, that's not covered by OHIP, so that might be a test that you have to pay for. And one of the themes you're going to see here with all the programs is that drugs and medications at this time are not covered under the Ontario Fertility Program. And unfortunately, a lot of times they're not also covered or not covered enough by people's extended benefits. They might be considered what we call a lifestyle medication. And I've certainly seen this where patients were told they were going to get coverage for the $11,000 they spent on medications, and they end up getting coverage for $3,000 of it. And so our mandate this year is we're trying to push for more drug coverage, because this can be a really big add-on expense, even though it's considered, a funded paid cycle.
Absolutely.
There's so many other expenses.
I often hear that, and it was certainly true in my case, although I'm not in Ontario, medications are about half the cost a lot of times. So it's a significant piece of the puzzle for sure.
It's huge. I mean, some like Hagen, the growth hormone, is like around $5,000 per cycle. And I see this with patients. And it's also, when you're starting, it's kind of like, okay, we need the money right now. And it's like, and that's where you guys are doing a great job talking about how you can finance things. But a lot of people think when you hear that, people are getting free IVF, it's definitely not free. There's still a lot of expenses, but we're so fortunate in Ontario that we do have coverage, because it takes a lot of that financial strain off. And so the big one that I'm really going to talk about is IVF, because that's obviously the most expensive, the most invasive, and that's what we see funding for. And so, as I say, eligibility is based on the person who is going to undergo the embryo transfer, so the person who's trying to get pregnant. And you must have a valid Ontario health card. You must have not done a funded IVF, and you must be under 43 years of age. So those are the eligibility criteria, the kind of, absolute mandated. At the same time, there can be some discretion around other things. If the physician feels you are maybe not healthy enough, or is not a good time to do IVF, they might ask to see some changes before they go ahead with it. So be aware that there is some physician discretion in that as well. And other people may participate in your funded IVF. And so if you're using donor eggs or donor sperm, that can be part of it as well. But they must also hold a valid OHIP card. And so let's say you are a gay male couple and you are using a surrogate and her donor eggs, and you would like her to be covered. She would need to be an Ontario resident in order for her to qualify for the program. So keep that in mind if you're potentially needing some access to some other help building your family. That OHIP piece is a really important part. So how do you get the funded IVF? So this is where it can get a little bit harder. So you might need a referral from your family doctor, and you need to go to a clinic that's participating. And at this time, there's about 50 clinics in Ontario that are participating in the funded IVF cycles. A lot of them are in Toronto, and some of them that are participating, though, it might just be for things like cycle monitoring. So be aware, if let's say you live in Sudbury, you might be able to do some of your cycle monitoring and your blood work there, but your actual egg retrieval and your embryo transfer might have to take place in the GTA. And this has been certainly some issues and criticism around the program, because depending on where you live, you might have more or less access. And so we are trying to ensure that people who don't live right in Toronto are able to access it still.
And Laura, so what is the reasoning behind the majority of funding being in those clinics? Is it because there are no other clinics on the outskirts, or?
It's a good question. I mean, one of the big things is that in Toronto, it's where a lot of the labs are. And so the things like the egg retrieval is the most expensive part of anything in terms of the setup, the technology needed. And so I think it's just kind of all the resources over the years have gotten pooled in those areas. And so that's where these smaller communities might not have access to it and people need to come down. That is changing and getting a little bit better as we start to grow and expand outwards. But really, we do see that concentration in Toronto.
And do all fertility clinics in Ontario have access to this funding?
No, only specific ones. And so if you go to, I'll just double check what the website is here that you can go to. I think it's just like Ontario. So it's ontario.ca/fertility.
Okay.
And if you go to that website, that's where you can get all the information. And that's where you can see the list of clinics that are participating. The one thing with that is that there is sometimes can be quite a bit of a wait, and that's not to say it's an absolute. Every clinic has the ability to manage their wait list differently. So some used to do a lottery, but that was really hard, and so they've gotten rid of that. And a lot of them now do kind of like a first come, first serve. So you're put on the list and then it's first come, first serve. And so let's say then you get an email saying now you're eligible. You kind of have to act quickly, because if you delay, you might lose your spot to someone else. And the way the program works, it runs with the fiscal year in April. And so actually April 1st was going to be when any new treatments for 2020 were to begin here in Ontario. And unfortunately, all of those cycles have been put on hold because of COVID. The funding is still there, so that piece hasn't gone away. People can still access it, but there will be a bit of a delay now in accessing that funding.
And Laura, is there, I know that there is a bit of a wait time. So if you've put yourself on a waiting list for a funded cycle, how long is that wait list typically?
Yeah, and it's a really great question, and it can totally vary. Certain clinics get more funding than others, and it can really depend on how big the clinic is. And so there's different spots allocated to each clinic. It can be anywhere from 3 to 4 months up to, unfortunately, 2 years. Sometimes if people are able to travel a little bit outside the GTA to areas like Kitchener, Waterloo, or Guelph, sometimes the wait list can be a little bit shorter. But the best thing to do is talk to the clinic, because I've certainly seen where people can get in quickly. Other clinics take a little bit longer, and you are allowed to be on more than one wait list. So you could sign up to be on wait lists at 2 clinics. We just ask them that, let's say you get off the wait list at one clinic, you call the other clinic and let them know. Or sometimes people get pregnant naturally while they're on the wait list, then taking your name off there. And so there are these things that we're working through, and obviously we wish the wait list was shorter, but the way the program works, because it's a capped program, it gives us spending predictability on how much the government's going to spend. But that also means that wait lists can be a little bit longer.
Of course. And doesn't it go to show how the strong need for continued funding or access to this treatment in the country, not only in Ontario, but if we've got to wait 2 years, people need treatment, people need access to treatment. And that just goes to show that although we're talking about the Ontario funding program or fertility program today, that the other provinces in this country need access and can learn from what you're talking about today as they pursue their own advocacy efforts.
Yes, and I think so. I think that's what we're really trying to show, is how the program can work really efficiently. And so with that cap spending amount, we know that there's predictability each year with how many people receive it, how much there is going to be spent. And then the other thing is that there is a single embryo transfer policy. And so this means that anyone who is doing the funded IVF program is only allowed to transfer 1 embryo at a time. Again, there are some extenuating circumstances based on age. So if people are over 38, they can ask to transfer 2. But we have seen a huge drop in the decline of multiple births in specifically in Ontario. So twins or triplets going down to more singletons. And we know that that is very cost effective for our healthcare system, better safety for the mother or the person who is carrying the child, and just better overall in terms of adverse health outcomes. And so even though it seems like, well, we're spending a lot, we are saving in the long term, because we've put these procedures into place which other provinces can then learn from.
Of course. And even better health outcomes for the unborn babies.
Yes, exactly. And so with the, as I said, with the funded IVF, as you say, wait lists can be a little bit long. And then let's say you get the email and you're like, okay, we're ready to go, we're gonna start. So really your cycle start point will begin when you start with that egg retrieval. And with the funded cycle, you get 2 attempts at cycle monitoring. So that's where they'll be monitoring and looking for those follicles to grow. So let's say that first one, you're just not having great growth. Maybe they haven't totally figured out your medication protocol yet. Maybe there's some other complications that come in. They are able to wait and do 1 other attempt at cycle monitoring. So they might adjust your meds, up the dose, lower the dose, add in another one. And then when they go in for the retrieval though, there is 1 single attempt at the egg retrieval. So that's when they're actually able to retrieve all of the viable eggs. And then at that point, either doing fresh or frozen embryo transfers moving forward. And then your cycle endpoint will end once you've transferred all of those viable embryos. So let's say, for instance, you retrieve, I'll say 15 eggs, 10 of them fertilized, you get 5 frozen embryos. Your funding will follow the transfer of all 5 of those frozen embryos. Once you've transferred all 5, that's when your funding cycle is concluded at that point. Throughout all of this though, your medications are not covered. So again, that's a really big expense there. Certain tests, the sperm washing won't be transferred. Your storage of those embryos are also not covered. So thinking about those storage fees every year that you'll need to pay if you have multiple embryos that you've frozen. And then certain tests, so a big one being the genetic testing, so PGS or PGD, the pre-genetic screening, which can range anywhere from kind of 3,000 to 6,000 depending on the clinic. Those things are also not covered. And so it's really great that we have the program, keeping in mind that you might have other expenses that you will want to budget for as well at the time.
Absolutely. And so Laura, when a patient gets accepted into this program, they get the email, how quickly after that email comes in would a patient be seen for an initial visit? And are there upfront costs, or is the program, does the patient pay for this and then receive a refund, or is it all covered under OHIP and you don't see a sort of a bill for that, for the services received that are covered?
Yeah, and so it can depend on, again, the clinic, and I can talk to kind of my experience working with patients as their naturopath. Usually it is fairly quick. So when you kind of get the go ahead, it's like, all right, on your next day 1, you're calling in. So day 1 being your first day of full flow of your period, you're calling in, you're getting ready, here's your medications, it's go time kind of thing. And so when I've had patients find out that they're getting that funded cycle, it's sort of happening within the next sort of 1 to 2 months. The exception being sometimes, like I say, with the fiscal year running April 1st, let's say you find out you've been accepted in the program in February, a spot comes up, but you have to wait until April when they get new money. And so, but usually it is quite quick. And as I said, it's something that you have to be ready to take your spot. That's that whole first come, first serve, or you might lose it. And then in terms of cost, some clinics will take a little bit of a deposit. And so that deposit can just be covering things like your medications or testing, just to ensure that you're able to cover those extra costs. But you won't get a bill for the other part of the procedure. So when you're doing the cycle monitoring, which is going in sometimes daily for blood work and ultrasounds in the morning, that would all be covered throughout it. And then you would just need to be ready to pay for your medications in order to go ahead with those. And most clinics too will set up, they'll have like a dedicated finances person. And so they will be able to send you a cost estimate ahead of time, which is really helpful. So they'll kind of break down based on the protocol that the doctor has put together. You might have this much for this medication, this much for that. And so you can prepare, and that's where that deposit can come in. But everything else, as I said, the retrieval, the transfers, all of that will be covered.
Okay, great. That's really helpful. Very helpful. So we have a couple of questions that are starting to come in. Is it okay if I kind of ask a couple?
Yeah, go ahead. I haven't been paying attention, so I'm glad you have.
No, I'll take care of all that for you. Don't worry.
Okay.
So how did the program get started in Ontario? What can fertility patients in other provinces do to get funding in their provinces? I really like this question.
So it started back in December of 2015. I'll be honest, I joined Conceivable Dreams, the board, last year, so I wasn't around in the inception of the program. So I'm not entirely sure who, but I know that a lot of the fertility clinics played a really big part in advocating for it because they saw a huge shift in their patients, taking away a lot of that stress. So to the best of my knowledge, it was kind of advocacy among the patients and the doctors. And we really, okay, perfect. Thank you for helping me out with this one. And what we did see is, there was some fertility coverage in Quebec, and, which was really great. One of the concerns and some of the issues where Quebec, where people had pushback is because they didn't have a capped program, it started to kind of, expenses kept going up, and they weren't really setting a limit on it. And so Ontario was able to see then that we make it sort of a program that has capped spending, we put an age limit on it, we allow, a single embryo transfer to help reduce those risks of multiples and added expenses. So we can show that it is a cost savings program overall. A lot of those things made it really helpful. And so we do work closely with IVF for BC,
yes.
Helping with them and their advocacy. And so definitely if people are like, how can we see how this program works? Can we see what you've done as Conceivable Dreams? You can reach out to us and we'd be happy to help, because so far, don't get me wrong, the program is not perfect, but it's working well and it's making a big difference in my patients. I truly see it. And so we're able to show what we've learned and kind of putting in these stop guards of spending predictability, single embryo transfer, and age limits has helped show how this program can be beneficial and cost savings for us.
Absolutely. And I'm glad that you mentioned IVF for BC, because there are several patient organizations in this country who are working towards this common goal. And what's really nice is that we've created a sort of a coalition. We call it the National Working Group, but it's Conceivable Dreams, IVF for BC, the AIQ in Quebec, and Fertility Matters, to get together and to ensure that we're sharing best practice and learning and supporting each other, as provincial, my gosh, I'm so sorry. As elections are coming up and patients are starting to mobilize, we rely on each other for those types of things. So Conceivable Dreams has been a huge part of that, because you had a seat at the table when this program was being developed. And what was really important is that not only was Conceivable Dreams, but the patients sat down with the government officials and the medical fertility experts to develop this program. And I think that speaks volumes to the importance of advocating on behalf of yourself, on behalf of your province, no matter where you are in your treatment cycle. And if you're watching this in your province, you don't know if your province has an advocacy group, please reach out to us, because we'd love to get you hooked up. And if there isn't one in your province, maybe we can help you get that started, and we can meet with Conceivable Dreams and learn from them and get things rolling in other provinces that don't have funding, or even those that do have funding that feel that maybe they need to advocate for continued access.
And that's, I think, is such a good point. And I think it's just starting with having the conversation. We did I want to say it was November, a breakfast and babies event at Queen's Park, and speaking to some of the members there and discussing the program and what it's done for people. And we had some amazing guest speakers with Dr. Dixon and Terry Hart. And you could really tell how, a lot of people just had, didn't understand the concept of how expensive it was, how valuable it was, how stressful this time is for people, and how essential this funding is. And so really advocating and getting in there and speaking to your members of parliament can be a great way to start.
Absolutely. We've got some more questions coming in. Do you want to continue speaking, or would you like to go to questions? How do you want to?
I'm good with questions. Yeah.
Okay.
Yeah. And hopefully they'll get to things that I didn't have too much else. So.
Yeah. Okay. So this question is, you mentioned that you can be on multiple clinic wait lists. Have you found that clinics don't like that? I can imagine that they might react adversely if I asked for my file so I can do this.
Yes. So I can't speak from that personally. I wouldn't say that they outright advertise it. So it can definitely make it hard for them because they're trying their best to manage everything. So I would say, I don't want to speak on behalf of each clinic. I'm sure that it's not making their life any easier, but it is something that you're able to do. And so the only thing that we do ask is if you do it, so if you are, getting that referral and wanting to see, oh, this clinic has a 2-month wait list versus the other one is a 2-year wait list, you can certainly work that in. But if you get off the wait list at one clinic, then absolutely please let the other clinic know, so that they can open up that spot to someone else.
That's good advice. And then it just cleans up the process. If 2 people are calling the same person at the same time, that's holding it up for other patients who've been in the queue as well. So yeah. If coverage lasts until all embryos have been transferred, does that mean one could have more than one pregnancy, or simply that you can keep trying until after no embryos are left or a pregnancy happens? That's a really good question.
Yeah, okay, so I'll try to, I guess, break it down. So we'll go back to that. Let's say you have those 5 embryos, right?
Yeah.
And the one thing is though, with the program, you can't freeze your embryos and then use them years later. So once you have that retrieval, it's kind of within a month after finishing that retrieval, you're expected to transfer that first embryo. And let's say, fingers crossed, that turns into a viable pregnancy, you carry the term, and now you're 1 year postpartum with your 1-year-old and you're ready to transfer that second embryo, that would still be covered under your funded cycle because that funding is following your uterus as the person who is trying to get pregnant. So your medications, you'd have to pay again for the priming for that second embryo transfer, but all the other blood work, ultrasound, everything would be covered. Now, let's say that one doesn't result in a pregnancy, and unfortunately the next ones don't. Your funding will come off, it will end once you are out of all of those embryos. So whether or not they turn into a pregnancy, the funding stops. But if you do have a successful pregnancy and carry the term and have a live baby, those other frozen embryos are still eligible for the funding because it's you, the person who's using them. So I hope that clarifies a little bit.
Definitely. Is there a time limit? So for example, if someone had a successful pregnancy with embryos frozen, and then waited several years to use those other embryos, as long as the program is in place, how would that work? If you waited, for example, my personal experience, I wasn't in Ontario, had a successful IVF and then frozen embryos, and we waited several years before we transferred those. How does that work?
Well, in Ontario, so that's why that kind of that first one, you sort of have to transfer within the first month. And then you do have to kind of keep, using them. You can't sort of wait. As long as the funding is still in place, you could use it after successful pregnancies. But, if they were to suddenly cut the program expenses, that would be a bit more of a concern then at that point. And that's why we want to ensure that there's the continuation of the funding each year. But for essentially how it works is each person is allocated a set amount of money from the government. So the idea is that money would kind of still be there for you in the future.
Okay, that's awesome. Thank you for clarifying that. I'm just looking. Did I hear you say that a sperm donor needs to have an OHIP card?
Anyone who's involved in the process would need to have an OHIP card in order for it to be covered under the expenses. With a sperm donor, though, you still have to pay for that donor sperm, and so that would be part of it. More what could be something is if you were using a surrogate and donor eggs, then that person, because again, the funding, if you think of the funding following the uterus, the person who is trying to get pregnant, that's where you could have that coverage under that person. Whereas if you are buying sperm, then you would have to pay for that. But if you were using your partner's sperm, and so you're not getting it from a sperm bank, then that would be covered. But the purchasing of donor sperm, you would have to pay for that.
Okay. I think that answers our question. What's the plan to reinstate treatments in the wake of COVID? Will the wait times be much longer? And what happens to people who had funded cycles canceled?
Yes, and this is, I think ongoing, and I know that every clinic will, be covering it a little bit differently. And so right now with Conceivable Dreams, we are trying to work with the clinics to ensure that access is still there once clinic reopens and make it as smooth as a transition as possible. And so we're really working with, we have a working group with several leaders across fertility clinics in Ontario, looking at how and when it will be safe to open in a manner that we can allow access again. And so if you were one of those people who's were canceled, or let's say you were set to do a funded cycle because April 1st was the start date and most clinics closed down right before April 1st, that funding is still there. How they're going to allocate bringing people back in a safe manner, because as you know, in wait rooms, it's very close quarters. Clinics are still working through that. Same with how they're going to allocate personal protective equipment, because it's a lot of PPE used for egg retrievals. And so that is still something that clinics are trying to figure out all on their own. I can say that if you had that funding, you'll still be able to access it. And if you were set up, in terms of wait times, we'll have to see that obviously everything's getting pushed back now until late spring, but that doesn't mean that you'll lose your spot. As to what they'll do, I think we're still working on it.
Yeah, I think so. I know in speaking with several clinic directors and lab directors, they're still working through the details of, when doors open, what's that going to look like. But rest assured that clinics across the country are, they're still working behind the scenes. They're still meeting with patients, and they will do everything that they can to ensure that patients get through safely for not only the patient and the staff, but also the embryos that are in storage and these potential babies. So everybody's taking as many precautions because there's still many things that we don't know about the virus. But I do know that everybody's working to ensure, and we've got committees set up across the country with fertility specialists who are working to make sure that the guidelines when clinics open are ensuring everybody's safety.
And I can say too, when things are starting to get a little, I guess, hairy at the end of March, and we knew at some point, unfortunately, things were going to have to shut down. A lot of clinics were opening to virtual consultations. A lot of clinics, they're still doing virtual consultations. But even for cycle monitoring, a lot of clinics had extended their hours so they can space people out. So I think there's going to be a lot of working and finding ways that fits, and we'll see a lot more changes to come in the next few weeks.
For sure. If you do not have any viable embryos following an egg retrieval, would you be eligible for another IVF cycle? So I guess that's, you do an IVF, do a retrieval, and there are no embryos after that process. What happens there?
What happens, yeah. And so that's what we would consider under the Ontario Fertility Program. That would be an endpoint. And so this would be one of those things that I've seen, and it's totally heartbreaking and sad and can happen. And so let's say you go in for the egg retrieval, and sometimes what we think are follicles can actually be empty. So you can try to retrieve a follicle and there's no egg in it, or they're attempting to retrieve maybe only a few eggs that have grown and they aren't able to get them out. Or you retrieve those eggs and none of them mature to a blastocyst. At that point, your funding would be stopped. And so that's where you can do those 2 cycles of cycle monitoring. So if they're seeing in one cycle that they're not happy with the results, they can cancel and do another cycle. But the egg retrieval itself only has 1 attempt. So whether or not you get any eggs, whether or not those eggs make it to a day 3 or 5 blastocyst, at that point it would end. And to do your next round of IVF, you would have to pay out of pocket at that point.
Okay, thanks for clarifying that, because I'm sure that's, as you said, it's come up, and it's good to have clarification on that for sure.
Yeah, and I mean, I've seen it happen, and it's like, so, I mean, it's heartbreaking, and that's where, I think at least we have the 2 cycles of cycle monitoring, and so that it's not just, well, that month didn't work, too bad. They can, and I've seen this, they will stop and adjust the protocol if they need to, and save that funding for the next cycle.
Oh, that's great. That's so good. So let's flip over. I'd love to hear more about Conceivable Dreams and what your goals are as an organization for 2020.
Yeah, so as I said, we are a grassroots organization. We're a not-for-profit here in Ontario, and we have You Guys Fertility Matters Canada. You guys are really involved in patient advocacy and patient engagement, whereas our mandate is really ensuring access and the continuation of the Ontario Fertility Program. So we're really focused on funding and allowing funding for fertility treatments, regardless of sexual orientation, family, gender, across Ontario. And so last year, our big push was the continuation of the program because there was so much on hold with the change in government. We were quite concerned, at one point, what if we lose this program completely? And so we really, really pushed and worked with the government to ensure that it stayed around. And this year, when we kind of set out on our planning committee, what we wanted to try to look at was drug coverage. And so that's where we're kind of looking now with insurance companies, or, we have some really great relationships with some pharmaceutical companies who have been big supporters of us, and working with the fertility clinics to see how can we get a little bit more coverage. And so that might mean with insurance companies increasing the cap that they put on, because a lot will put on a max of 5,000 on fertility drugs, which just doesn't cover all of it, or changing the category. And so that's something like a gonal asp, for instance, which is a common drug for an egg retrieval, is not considered a lifestyle medication, but is considered infertility is a medical condition, and so it's considered a medical drug, and we can have more coverage for that. And so what we're hoping this year, now that we know we have the program in place for 2020, is we can work with lobbying for better drug coverage.
Awesome. So if patients or individuals, let's talk about patients or in Ontario, no matter where they are in their fertility journey, how can they help? How can they get involved with Conceivable Dreams? What does Conceivable Dreams need from Ontario patients?
Yes, and that's a great question, and it's something that we're always looking to. And so we're always looking for more help. We're always looking for more volunteers. We are completely volunteer run, and if you actually go to our website, that's where conceivabledreams.org, we do have a call out for board of directors, and there's some very specific roles that we're looking for. So for instance, I work in patient engagement, so my job is engaging patients, making sure that they feel that they're being advocated for, but we do need some help with social media. We do need some help with our accounting. There's a lot of different roles, and so by visiting our website, again, conceivabledreams.org, you can see our call for a board of directors, how you can get involved. And for some other people, that might be a bit too much, right? It is a big ask to be on our board. So then we're always looking for volunteers. So on top of our board of directors, we have an amazing group of volunteers. If we're like, hey, we need help, putting something out on social media, or, perfect example, we put together this survey where it's little tasks here or there where someone might actually be an expert in that area, and they're able to help out with us. Last year, we did our big Breakfast and Babies event, Breakfast and Babies event at Queen's Park. And we had some volunteers, we had some patients show up with their children who were made with the program, and so that they could speak to their personal experience too, who were able to help us and support us there. And so absolutely, we're always looking for more hands, and we'd love to hear from you and connect with you.
Awesome. So for patients who are not in Ontario, who are in a province where there isn't an active, or potentially might not know if there's an active patient advocacy group, such as Conceivable Dreams, what would you tell them? How can they get started? What advice would you give to someone who's looking to get things going in their own province? That might be a hard question, I know. I was just thinking.
I think I have a few answers to that, so it's good. I think you first want to check, is there already an advocacy group? Because we are stronger in numbers, and that's where I think you guys are great, because you're Canada-wide. You could reach out to Fertility Matters Canada and say, hey, who's our advocacy group?
Absolutely.
If you're in BC, you might not have known about IVF for BC, and now you know you can work with them. And let's say you're in a province where there isn't one. then you could connect with us and, ask us like, how did you get started? What worked? What didn't work? Because we want to share these resources, and we want to see this become a Canada-wide program, not an Ontario fertility program. And so I really do believe it's strength in numbers, and that's why it's so important to work together. And so if you're unsure, you can look at Fertility Matters Canada. They have tons of resources. And if you want to get something started, you could always reach out to us.
Yeah, and we can work together to help people get these groups going in other parts of the country. I think it's incredibly important. You've got a lot of information to share. I know you have worked closely with the group in British Columbia to really, get that IVF for BC up and running. And so I'm thrilled about that. And so we have actually another group in the Atlantic provinces. So it's called East Coast Miracles, and we're actively looking for patients to take over that organization. And get things rolling in the 4 Atlantic provinces. So I'm thrilled that the Conceivable Dreams is an option for support and for collaboration across the country, because as you said, we are stronger together. And although patient access might not look the same in every province, we can work together with a common voice to ensure that patients have the resources that they need to access care.
Absolutely. I mean, I see it. I'm from the West Coast, and I have friends out west who are going through fertility, and I forget. I'll ask like, well, are you on the wait list? And they're like, well, what wait list? And I'm like, oh, right, it's only in Ontario. And I think too, in Ontario, even if sometimes the wait can be long, even just being on the wait list gives people so much hope, and it just changes things. And, if you are able to get one of those spots, or even if you, want to start with IUIs and the IUIs are covered, it just makes such a difference, and you see such a shift in patients. And so that's where we want to see that the program continues, and we want to continue to make it better as well.
Awesome. So I don't think I'm just checking here. We don't have any other questions that have come in. I think we've answered everything. Do you have any sort of final thoughts or final words that you'd like to say?
I guess I had a couple talking points. Let me just double check here, see if I missed anything. No, I mean, those were kind of the main things. As I said, we were really just here to talk about the program and how it works. As I said, if you're unsure what clinics are participating, you can go to ontario.ca/fertility, and you can see a list of clinics near you. And as I said, always reach out to them, see what their wait list is at, reach out to us. We're pretty active on social media. We have a patient Facebook group, so you do need to be in Ontario, and you can just look up Conceivable Dreams, the OHIP for IVF Coalition on Facebook, and you can join our private Facebook group. We're active as well on Instagram and Twitter, and it's at IVF4 on ON. So 4 is in the letter 4, and then ON for Ontario. So at IVF4N, and we'd love to hear from you. We'd love some more support. And if you are someone who has had your treatment delayed or canceled because of COVID, please reach out and fill out our survey so we can understand how you've been affected. And that will help us then with when clinics get reopened, how they're going to reopen, how they do wait lists, to really understand the situation and make sure that our patients' needs are being heard.
Great. And we've actually put the link to that survey in the chat section of our Zoom window. So you're just going to copy that and put it into your web browser. And we've also put it in the comments section on the video that's going live on Facebook and in the event right now. And it will be continued to be published through our social media as well, so that we can maximize patient engagement for you.
Okay, perfect. Well, thank you, Carolyn. That was so much fun.
Well, this was great. I've learned, you think you know a lot, but I've learned more today, and I feel more confident than ever in my knowledge, thanks to you. And thank you for the work that Conceivable Dreams is doing. It is a volunteer-based group, so everything that's done is done, around busy lives and ensuring, family building continues to happen in Ontario and across the country. So on behalf of Fertility Matters Canada and our board of directors, thank you, Laura and Conceivable Dreams, for participating. It was very helpful. I'm sure it was very helpful for the people who are watching. And I hope that it's inspired patients in other parts of the country to get involved in advocacy efforts in their provinces. So thank you everybody for tuning in. Don't forget, it's Canadian Infertility Awareness Week 2020. We are bringing you fertility experts from across the country all week long via live video. You can't watch live. Please check back for the replay and find all of our events on our Facebook page. If you haven't subscribed to our brand new newsletter, you can do that from the link on our Facebook page as well. Laura, have a great afternoon, and we will see you all back tonight for one more session.
Perfect. Pleasure as always, and can't wait to see what you guys have on for the rest of the week.
Thanks, Laura. Bye, everybody.
Take care.